Hello everyone. So today we are going to discuss about some medicine calculations, which are very useful and very important for your Norcet preparation. And these questions look tricky, okay, and we feel bit difficult when it comes to exam when we don't practice. So here I have chosen 10 questions, and mostly all the questions will be solved in a same pattern. Okay, you will see that. So if you didn't subscribe the channel yet, subscribe it and share it with your friends. So let's start. So question number 1, a 72-year-old client on mechanical ventilation in the ICU requires continuous sedation. The provider orders. So the order is important. So we can write separately the order. Provider orders 20 microgram per kg per minute. 25 microgram per kg per minute. Okay. The client weighs 80 kg and the weight of the client is 80 kg. Okay, so this order is for per kg, 1 kg. So how much for 80 kg, that we have to calculate. Next, the pharmacy dispenses a vial of 1000 milligram Propofol in 100 ml, that is 10 mg per ml. They have given the dose also, 10 mg per ml. In 100 ml 1000 mg, and in 1 ml it is 10 mg. Calculate the correct infusion rate in ml per hour to set on the pump. So here the available dose also we have to write. Availability is 1000 milligram per 100 ml, that is 10 milligram per ml. Okay, then we have to find out ml per hour, the infusion rate we have to find out. So here we have 2000 microgram and here milligram. So these variations should not be there when we calculate. So what we have to do, we have to convert microgram into milligram first. So both the units should be same. So how will you convert microgram to milligram? So 1 milligram is equal to 1000 microgram. So we have to divide it by 1000. So 2000 microgram divided by 1000 is 2 milligram. So 2 milligram. Okay, and also it is in minutes. Okay, 2 milligram per minute. In the answer we need it in hour, so that I will explain later. Okay, that we have to note. Okay, this is in minute and we need it in hour, that we have to note. So now let's put it into the formula. The formula is dose, ordered dose divided by availability. Okay, available concentration. So ordered dose is 2 milligram per minute. Okay, the final thing we have to write, because we converted it everything, right? So they have given us 25 microgram per kg, but we converted it for 80 kg. Okay, the patient's weight is 80 kg, so we converted it according to the weight. Also we have changed the unit, so the final thing is 2 milligram, so that we have to put that one only. So 2 milligram per minute divided by the concentration is this one, available concentration is 10 milligram per ml. Now one more thing is we have to convert it into hour, right? The final answer should be hour. We can first divide it and then we can multiply it by 60 so that we can convert it into hour. Also we can now itself we can multiply it by 60. So if you multiply it into 60, it will be converted into hour, because 1 hour equal to 60 minutes, right? So now the answer is $12 ml per hour. Okay, we have converted it into hour. So the answer is 12 ml per hour of propofol we should set. Now the second question. A 5-year-old child weighing 18 kg. So the weight is 18 kg. History of congenital heart disease is prescribed Digoxin 0.02 milligram per kg per day. So the order is 0.02 milligram per kg per day. So per oral only, orally the patient has to take. It is divided into 2 doses. Okay, so BD dose it is. Okay, so per day the patient has to take 0.02 milligram per kg, but we have to divide it into 2 because the half dose should be taken in the morning and half dose in the evening, like that. So the pharmacy dispenses Digoxin elixir 0.05 milligram per ml. So it is giving it in per ml 0.05 milligram it is giving from the pharmacy. So the available dose is calculate the amount per dose in ml per oral for BD dose. Okay, so we have to calculate per dose. We have to calculate for 1 dose, not for 1 day. Okay, the order they have given per day, but we have to calculate per dose. Okay, so we have to read the question very carefully. Okay, now the order is for 1 kg, right? So now the first thing we have to do is, according to the kg of patient, we have to convert it. So that is the first step in all the problems. Okay, so now 0.02 into 18, because the weight of the patient is 18 kg, that is equal to 0.36 milligram per day we can get. Now to divide it into 2 doses, we can divide it like 0.36 divided by 2, then we will get per dose. Okay, so now the order is 0.18 milligram per dose. Okay, now availability is 0.05 milligram per ml. Okay, now clear, right? So now the units are also same, both are in mg only. So now we no need to change the units also. Now we can directly put it into the formula. The formula is ordered dose divided by the concentration, same thing. So yes, now I have calculated 0.18 divided by 0.05. So as the dot is there, we have to convert the decimal into fraction. I have converted the decimal into fraction. It's very basic. So if we multiply both into 100, we can get this fraction. It is very basic thing, right? The calculation. So 18 by 5, we can remove those decimal points. So 18 by 5, the whole fraction we can get. So if we divide these things, so 3.6 ml. Next question, a 6-year-old child weighing 22 kg is admitted with MRSA septic arthritis. 22 kg. The provider prescribes vancomycin 15 mg per kg IV every 8 hours. Every 8 hours. So in a day we have 24 hours. If we divide it in 8 hours, total 3 times we can give. 8 3s are 24. So 3 doses. This is TID dose. Yes. The pharmacy prepares vancomycin. The available thing is 500 milligram in 100 ml NS. That is the available dose. So calculate the correct volume to administer per dose. This is also per dose. Okay, not per day, per dose in ml IV Q8 hourly. Let us first calculate it according to the weight. So the order 15 milligram into 22 is 330 milligram. Now the available is 500 milligram per 100 ml. If anything is given like per 100 ml or 1000 ml, we have to convert it for 1 ml for our easy calculation. So 500 ml, 500 mg divided by 100 ml is 5 mg per ml. Okay, now let us put into the formula. Very easy, is dose by concentration. So the dose is 330 mg, concentration is 5 mg per ml. Okay, so now it is 66 ml. Next question, a 70-year-old man with acute decompensated heart failure presents with pulmonary edema. The provider orders Furosemide 80 mg IV push stat. The pharmacy supplies Furosemide 20 mg per 2 ml. Okay, so the order is 80 mg IV stat. Pharmacy supplies, that is available 20 milligram per 2 ml. So if anything is given in like this, we have to convert it for 1 ml, right? So now 20 divided by 2 is 10 milligram per ml. Okay, now let us put it in the formula. Dose by concentration 80 milligram divided by 10, 80 milligram by 10 milligram per ml, it is 8 ml. So the start dose is 8 ml. We have to give 8 ml. Next, a 3-year-old child weighing 14 kg is admitted with pyelonephritis. The provider orders Gentamicin 7.5 mg per kg per day. Okay, note it. The order dose is 7 points. In exam also you try to write like this, okay, separately to avoid confusion. Per day. IM divided every 8 hours. So they have given order for 1 day, but we have to calculate it for 1 dose. Okay, the pharmacy supplies Gentamicin 40 milligram. So the available is 40 milligram per ml. Calculate the correct volume per dose in ml IM every 8 hours. So we have to calculate it for per dose. Okay, read the questions carefully, whether they have given per dose or per day. Okay, what is the order actually? So everything we have to carefully read. Now, as usual, let's calculate it according to the weight. 7.5 into 14, 105 milligram per day. But we need it for every 8 hours. So every 8 hours means 8 into for one day, how many 8 hours? 8 into 3 is 24 hours, right? So 3 doses we have to give. So 105 divided by 3 is 35 milligram per dose. So per dose 35 milligram. Now the order is 35 milligram only. Okay, that you have to remember. Next, the available is 40 milligram per ml. Now let's put into the formula dose by concentration. Dose is 35 milligram divided by concentration is 40 milligram per ml. So 35 divided by 40 is 0.88 ml. Okay, so per dose the gentamicin should be given 0.88 ml. So now I hope you have understood why I have divided this whole into divided by 3. Yes, for 8 hours we are dividing it by 3. If it is for one day, we won't divide it by 3. Okay, that you have to remember. Next, 30-year-old pregnant woman at 32 weeks gestation is admitted with severe preeclampsia. The provider orders magnesium sulfate infusion at 2 gram per hour. The order 2 gram per hour. Pharmacy supplies a solution of 40 gram in 1000 ml. Availability 40 gram in 1000 ml. Calculate the pump rate in ml per hour. Per hour. Okay. Okay. So order is also per hour, and we have to calculate this for also per hour only. Okay. Now it is in 1000 ml, right? So now we have to 40 divided by 1000 is 0.04 gram per ml. Okay, so now for easy calculation, dose in mg, usually if we put it in mg, it will be easy for us. So the units are in gram, right? So we can convert it into mg. So 1 gram is equal to 1000 milligram. So 2 into 1000 is 2000 mg per hour divided by concentration 0.04 into 1000, that also, that is 40 milligram per ml. So now we can calculate. It is answer is 50 ml per hour. Okay, so answer is 50 ml per hour. If we calculate it into, like if we convert it into milligram, this will be easy for us, right? It's a whole number and we can calculate it easily. So if it is in gram, both are in gram only, but if we convert it into milligram, it will be easy for us. Next question. A 63-year-old man recovering from open abdominal surgery is started on a PCA pump with morphine. The provider orders a continuous basal rate of 2 milligram per hour. So order is 2 milligram per hour. Pharmacy sends a syringe containing 100 milligram in 50 ml NS. So availability is 100 mg per 50 ml NS. So we can calculate it for 1 ml. 100 by 50 is 2 milligram per ml. Calculate the hourly infusion rate in ml per hour. So now let's put it into formula. Dose by concentration, it is 2 milligram per hour divided by 2 milligram per ml. So it is 1 ml per hour. So the answer is 1 ml per hour. Now the eighth question, a 45-year-old client with type 1 diabetes is admitted to ICU in DKA. A provider orders the regular insulin drip at 0.1 unit per kg per hour. Okay, so the client weight is 70 kg. The pharmacy provides pre-mixed infusion of 100 units regular insulin in 100 ml. So availability is 100 units per 100 ml. So for 1 ml it is 1 unit per ml they are providing. Calculate the pump setting in ml per hour. So according to the weight, let's calculate 0.1 into 70 is 7 units per hour. So now let's put it into the formula, dose by concentration. Dose is 7 units per hour divided by the available concentration is 1 unit per ml. So here it is 7 ml per hour. It's the answer. Very easy, but when we read the question we feel it difficult, right? 2-year-old child weighing 12 kg is prescribed acetaminophen 15 milligram per kg every 6 hours. The pharmacy provides a liquid preparation labeled 160 milligram per 5 ml. So weight is 12 kg. Order is 15 milligram per kg. Availability is 160 milligram per 5 ml, that is 32 milligram per ml. Next, calculate how much liquid should be given per dose in ml Q6 hourly. So now let's calculate it for weight. It is 15 into 12. It is 180 milligram. Let's put it into the formula. Dose by concentration is, dose is 180 divided by concentration is 32. So 5.6 ml per dose. Okay. 58-year-old client, congestive heart failure, has potassium level 2.9. The provider orders 40 milli equivalent potassium chloride diluted in 250 ml NS to infuse over 4 hours. Calculate the infusion rate in ml per hour. So here the formula is total volume in ml divided by time in hour. So total volume in ml is 250 ml, right? This ml we have to infuse to the patient. Time is 4 hours. So the answer is 62.5 ml per hour. Okay. Practice is very important. Practice it repeatedly. Okay, now you feel like you understood once you solve 5 questions, but tomorrow or day after tomorrow you will